Coastal Vascular and Vein Center is open right now and treating patients. And joining us now to tell us more, we have Dr. William Ashwander to tell us more about virtual visits, practices during COVID, and kind of how you guys are keeping up with all the new changes. Doctor, good to see you this morning. How are you?
Doing fine, thank you. Thanks for having me.
Yeah, my pleasure. So just tell me a little bit more about yourself. First of all, you are a vascular surgeon. And what services does your office provide? What all do you do?
Yeah, so vascular surgeons treat conditions affecting all of the blood vessels in the body outside of the brain and the heart. This includes arteries and veins. So arteries carry blood flow away from the heart and thereby carry oxygen to our body, and veins return the blood flow to the heart. So as vascular surgeons, we treat all of these blood vessels. And it's not just with surgery. We provide comprehensive care, so medical management in addition to any procedures that may be necessary. So in our office, we have a full vascular lab, which is an ultrasound lab to image blood vessels and help in our diagnosis and treatment of these conditions. And so common conditions treated by vascular surgeons on the arterial side of things are abdominal aortic aneurysm, blockage in the carotid arteries, which are the blood vessels that carry blood flow to the brain, as well as peripheral arterial disease, which involves blockage that builds up in the arteries in the legs. On the vein side of things, we treat DVT, or deep vein thrombosis, as well as varicose veins.
All right. You listed a lot of things. I want you to tell me a little bit more about the peripheral arterial disease. How is that one treated?
Yeah, so peripheral arterial disease is the result of plaque buildup in the arteries going to the legs. And so PAD falls under the umbrella of cardiovascular disease along with heart disease and stroke. So all three of these diseases involve plaque buildup in arteries. They just occur at different locations in the body. And another word for this plaque buildup is atherosclerosis. And so with regard to PAD, when there is an inadequate amount of blood flow getting down to the legs, it creates a supply-demand mismatch. And what I mean by that is that when someone walks, the muscles in the legs need more blood flow than they do just sitting still. And so if there's an upstream blockage, that prevents those muscles in the legs getting the blood flow that they need, and that can lead to pain or discomfort with activity or with exertion.
Right. It certainly sounds painful. For someone watching right now who would like to make an appointment or have a consultation, how are you doing that now? Can they go in the office? Are you still doing virtual consultations?
So we are. We're offering virtual visits as well as office visits. And so in order to make an appointment, it's just as simple as calling our office. No referral is needed. So a simple phone call will put you in touch with a new patient coordinator. We can either arrange a virtual visit or an office visit. Additionally, appointments can be requested online. Within our office, we are following all CDC guidelines and recommendations. And so we offer distancing in the waiting room, as well as the ability to wait in the car until the appointment time comes about, and we can give you a phone call on your cell phone. We have additional cleaning and sanitation going on in the offices. All of our staff members are wearing masks, and we are using the screening questionnaires upon arrival to the office.
That's great. All those changes that you've made because of COVID. Thank you for your time today. One last question. It is bathing suit season. I'm sure there's varicose veins. Do you see an influx of patients this time of year to get our legs ready for the beach? We do.
And actually, virtual visits work really well for our varicose veins patients. So we can have that initial consultation, just right over the computer, and then, arrange any testing that needs to be done at a later date. So yeah, it works out well.
Good to know. Doctor, again, thank you for your time. You can call 577-4551 or go to coastalvvc.com for more information. Have a great day.
You too. Thanks so much.
Bye-bye.
Bye-bye.